Good day, beautiful, bountiful, beloved immortal beings, and good-looking people. Maybe good-looking. It's always looking for and finding the good. You found good in abundance because you tuned in consciously and conscientiously to Ion Las Vegas with your humble host, Barry Shore, the ambassador of joy. Notice I didn't say the ambassador of joy. The ambassador of joy. And you know, in this show, we discuss the three fundamentals of life. When you work with these three fundamentals, the reality is you'll be happier, healthier, and wealthier. Number one, life. Your life has purpose. Number two, you lead a purpose-driven life. You go mad. MAD stands for make a difference. And number three, we unlock the power and the secrets of everyday words and terms. And you're going to be meeting one of the more interesting people I've had the great pleasure of interacting with over the past few months or so, Dr. Rick Bernstein. He's going to save some people's legs and lives. So just get ready, buckle up, because he's an important, wonderful fellow. Now I got to tell everybody, I'm privileged to speak to millions of people around the world every month through my two podcasts, The Joy of Living and I in Las Vegas. Whenever I mention to somebody Las Vegas, their eyes all light up, their ears go like this, they lean in and say, tell me more. Everybody loves to talk about and think about Las Vegas. Let me tell you a wonderful data point about Las Vegas. If you take the entire population of the city of New York and everybody around it, the entire population of Chicago and everybody around the entire population of Los Angeles, everybody around it, and you add in the entire population of the state of Florida, it doesn't equal the number of people that come to Las Vegas in a year. 41 plus million people come to, through, and for Las Vegas in any given year. You know why? Because this is a place of energy. It's a place things are happening. It's a place things are good and developing, and especially in the field of medicine and in health. We have a lot of big elderly population here, and so there's a great need, and it gets bigger and bigger every year. And I am just so honored, so privileged to have with us today one of the great medical experts in this wonderful city. Please welcome Dr. Rick Bernstein. Welcome. Please say hello.
Hi, Barry. Nice to see you.
World.
Hello, world.
Okay, those of you who are able to see can see this great smiling face with these beautiful big glasses and just a beaming countenance, and that's exactly who he is. He is a healer. You can really feel it. And if you're only listening to his voice, you'll get to hear that in just a moment, and you'll understand why he is so good at what he does. I just want to tell you two quick things. Now we're going to go deep right into what, with your permission, Rick, I'll call you Rick.
Sure.
Okay, does. He's a board certified cardiovascular and thoracic surgeon. So everybody knows what a surgeon is. Well, you think you know, that means cutting people. Well, cardiovascular has to do with blood vessels, and the thoracic part has to do with the chest. However, these days, he is focused on the two limbs that enable everybody to stand, move, walk, do, and those are your legs. And he's here to save legs. That's one of the reasons I met him, because I was having an issue with my legs. And he went in and he looked and he said, hey, sure, you're fine. Nothing more we can do except that let's do a podcast together. So I said, okay, let's do that. So let's just jump right in and talk about, first of all, what is it about legs that people have poor circulation? And I'm talking about everybody from young people, meaning under the age of 20, all the way up to people, let's say, in their 70s and up to centenarians. What is it about the legs? Is it that they're big and long and they're far away from the heart? What is it that people have so many problems with their legs?
Indeed, you're right, Barry. The legs are long, but the length of the leg is not necessarily the issue. And more now, people's age is not so much of an issue. More of an issue are things that, for example, you can't have any control over, like family history, like what's in your DNA, and things that you can't control, like that, or things that you can control, like what you eat and what you do, like whether you smoke or not, whether you exercise or not, whether you look after your health by the type of diet that you eat. And what I do now is a specialty program, which is an amputation prevention practice. Why would people get amputations of their legs? An enormous amount of amputations are done in the world and in the United States because of what we call peripheral vascular disease. That has to do with blockages in the arteries in the legs. The arteries have the blood with oxygen and the nutrients that we need to live. When parts of the body don't get enough oxygen or nutrients because of blockages in them, those areas of the body die. And people can get very severe pain in their legs, including pain when they're doing nothing but sleeping at night that wake them up. And people can get wounds or sores on the toes and on their legs, which can then develop gangrene, which means an amputation. Once a person gets an amputation, their lives and their families' lives are destroyed. In fact, about half the people who get a major amputation of the leg are dead within 2 years. So, our objective in my practice now is to prevent amputations by when people have symptoms and they're sent to me, we find whether or not they do have blockages in the arteries in their legs. And right in my office, without having to go to the hospitals, in about 99% of the patients, we can reopen those arteries and restore the blood flow without surgery and save their legs.
Okay, you just heard a mouthful, world, and I am a testament. I'm giving testimony to everything that Dr. Bernstein just said. And I'm very happy because it happens to be that people who know and listen to my podcast know part of my history that I was a quadriplegic overnight from a rare disease. I became a diabetic, type 2 diabetes, which is the leading cause of problems with the legs and such like that. So I was sent to Dr. Bernstein because my legs were cold all the time, still are actually. And we did ultrasound, and he found that, in fact, okay, Barry, you're fine. Just, I guess, keep doing what you're doing because it's okay. Now, I will say my diet is, I'm very careful about my diet. I eat well. I do not smoke. And I exercise. I'm not able to walk like most people in the world. I swim. And apparently that swimming is capable of helping my legs become, have the blood oxygenated enough. So I was not subjected to anything other than Dr. Bernstein saying, hey, sure, keep doing what you're doing. However, I want to make mention of something that you talked about, gangrene. Just even saying the word, to me, it harkens back to the Civil War. I mean, ancient times of the idea that anybody would have gangrene, it seems almost impossible in the 21st century that that's an issue. And you're saying it is.
It's hard to believe, but that's true. And one of the reasons for that is that there's a major increase of rampant diabetes in the world today and in the United States. And diabetes is deadly for blood vessels. It helps to worsen what we call plaque buildup inside the arteries. It's like if you can imagine beavers building a dam across a stream. That these plaques gradually build up from the foods we eat, and because diabetes injures the inner lining of blood vessels and causes blood vessels to develop clots, calcium blockages, and just like these beavers build gradually a dam across a stream, that's what happens in our arteries. Now, fortunately, our arteries and the way God made us is so great that we can compensate until the blockages get to be more than about 70% with very minimal symptoms. But once the blockages get to be over 70%, then the flow downstream drops quickly. And then people get pain. It starts out with pain when they walk. Why? Because when you walk, the muscles in your legs need more blood. Or if you exercise, well, those muscles can't get blood because of the blockages. So those muscle cells switch to metabolism based on carbon dioxide, not oxygen. And that makes what they call lactic acid in those cells, and that hurts and that burns. So what do? They stop walking or they stop exercising to let the blood flow catch up. And that's a entity we call intermittent claudication. That's a major warning sign that something is wrong. If the blockages get worse, or if they block completely, then if they block suddenly, that's like a heart attack in the legs, and the people have to get to the hospital quickly. But more often, what we see is these blockages developing chronically or slowly. So, what happens is when people progress and they're doing nothing, like sleeping, the muscles in their legs aren't getting enough blood. So, again, those cells have metabolism not based on oxygen. So, they make lactic acid. That hurts. So, what do? They awaken from sleep and they hang their legs off the side of the bed or stand up. Why? Because then gravity helps assist pulling blood down to their legs and feet, and their pain gets better. All of those situations we can help and open those arteries. But if people wait too long and the blood supply is compromised, say in a wound that becomes black, that is gangrene, and it starts lower down in the toes. It can spread up. And if we can get to people earlier, we can save those people from getting amputations.
So let's ask the seemingly obvious question. Someone who is experiencing pain in their legs, whether it's above the knee or below the knee, should, I believe, go to a doctor as soon as possible and explain that. And are there things that someone can do short of coming to you and having an ultrasound and such that can relieve that? Is it, in other words, go through the pain even though when you're exercising, you have pain, keep exercising because it will burn off the lactic acid or not?
So that's a good question. If a person just has claudication, meaning that the pain comes on only with activity, but not with rest, and the pain dissipates after a person does rest, then it's not quite as serious a problem, but it's a warning sign. Now, those patients can get better because the body is very smart. It will make its own little mini bypasses around blockages we call collateral circulation. And that can stave off or prevent someone from getting rest pain and getting gangrene. But if they get that warning sign, they need to be seen. They need to be evaluated because if a blockage goes quickly from a 70% block to a 95% block, person's going to be in trouble. So they need to speak with their family doctors if they have those symptoms. And more importantly, although this sounds intuitively silly, you have to ask your family doctors to take your shoes and socks off and actually examine your feet. Because a lot of the times we see patients and that doesn't happen. The pulses in the feet have to be felt, and the color of the foot has to be looked at, and a number of different things, but it can't be seen through shoes and socks.
A lot of stuff can't be seen through shoes.
And some shouldn't, probably.
Right. We have, thank God, sponsors that love our show. We wouldn't have them on if we didn't think they're worthy of your time and attention. We're going to be right back with No Shoes and Socks right after this brief message. Don't go away. There's more Dr. Bernstein and benefit for you on the other side. Be right back. Opportunity. What an opportunity. I'm going to use 2 4-letter words right now. Free gift. Free gift. Yes. You can have a copy of my best-selling book, The Joy of Living, How to Slay Stress and Be Happy, the ebook version for absolutely free. All you have to do is send an email to me, Barry, Barry, at barryshore.com, and in the heading, the subject line, just write, free gift. It's as easy as that. This is a life-changing, life-enhancing opportunity. Barry at barryshore.com. You'll be glad you did. Thank you, thank you, thank you. Free gift. Do it now. Take the action. Make it happen right now. Best wishes. Bye. Good day. Beautiful, bountiful, beloved immortal beings, and good-looking people. Maybe good-looking, because I was looking for and finding the good. We found good in abundance. His name is Dr. Rick Bernstein, and he is teaching us how to make sure that you don't have any beavers in your feet building dams and causing lactic acid and pain and all kinds of not good things, gangrene, maybe even amputation. I hate it. It's hard to even say the words. So you left us hanging with no shoes and socks. So I'm going to ask you, based on what you just said, is it not better to go to a podiatrist than to a family physician?
Another great question. Often podiatrists are the first doctors who see this problem. And podiatrists who are in the know and understand about circulatory problems are one of our greatest referrals, because even if someone has poor circulation and they go to their podiatrist to just get their nails trimmed, and if the toe does not have enough circulation, and just by accident, uh, flesh around the toenail is nicked by whoever is trimming the toenail, that we've seen this a lot, especially in diabetics, people who smoke, people who have kidney disease. That little nick in the skin in the toe can rapidly turn to an infection and gangrene, which will spread up the toe. So the podiatrists who are in the know, they've learned how to feel pulses. They've learned how to look at the color of someone's foot and see if it's normal or not. And they are one of our greatest referral sources to help us get to the patients early before something really serious happens.
So you mentioned, I wrote it down specifically, you didn't say pulse, you said it in the plural. So pulses, what are the pulses that a doctor, podiatrist, or family physician are really feeling for? It's not just the pulse that one takes to know the heart rate. You're talking about pulses. What are these different pulses?
So, similarly to when a person can feel the pulse in their wrist, we can feel the pulses on the feet. They're called pedal pulses. And there are actually three arteries that start from the knee and go down to the foot that give the blood supply down to the foot. Each one of them has its own pulse. Two of those pulses should be easily felt in a normal person's foot. The third one is deep in the muscle, and usually you can't feel that one. But there's a pulse called the dorsalis pedis, which is an artery on the top of the foot. And there's one called the posterior tibial artery, and that is on the inside part of the foot, right below the ankle bone. Those should be able to be felt. And if you can't feel those, or if your doctor can't feel those, that's a problem.
And even if they're weak, as long as they're there, that's the key. Is that correct?
If they're weak, that's usually a sign that something's wrong. Why should they be weak? So one has to investigate, and that's what we do, why they're weak. And the way we usually do this in an objective fashion that is absolutely non-invasive, and you get terrific information, is from a proper arterial ultrasound that we do in our office.
Which I am happy to say I had done. I'm very happy to tell everybody I'm not pregnant. And I and the ultrasound said that we didn't have to go in and open up any beaver dams because apparently I was fine. And again, I'm urging everybody to understand what we're talking about here is, I'll say it like this. I want to scare some people into doing something good for yourself. Because too often, and I'm saying this, Dr. Bernstein, if I'm wrong, you'll correct me, of course. Too often people let things go to the point where they get, like you said, past the 70% mark, whatever the number is, and it becomes far more difficult to attend to. Whereas if you do, without being a hypochondriac, if you do attend to something right away when you are feeling some, in particular, not just discomfort, pain and things like that, please do not hesitate. Is that fair to say?
That is very fair to say. In fact, the most severe form of this arterial disease that we're talking about in the legs is called critical limb threatening ischemia, or CLTI. And that disease, if the disease becomes that advanced in a patient's legs, the risk of them dying is higher than every other type of cancer put together with the exception of lung cancer. CLTI is a deadly disease, and that's why we would like people to get screened. We would let people to get examined, and welcome to come see us if they have any questions at any time, because if you save a leg, you save a life.
I like that. Save a leg, save a life. I'm gonna mention two things here. I have a very dear friend for more than almost half a century, and recently he told me he has something called gout on his toes, and now you're talking about gout, gangrene. I mean, again, this sounds like the 18th century or 19th century. Uh, Please correct me. I think gangrene, I think the color green. What actually is gangrene and what is gout?
So gout is a buildup of something called uric acid crystals, which can happen anywhere, but mostly happens in the big toes. And it can be extremely painful, but it's very readily treated with medication. Gangrene is black discoloration that results from parts of the body that are no longer alive. It can be in a toe, it can be in a foot, it can be in a leg, it can be in fingers and hands for that matter. But gangrene is black, and it is the end stage of these kind of diseases where once gangrene sets in, that part of the body is no longer alive. If you can get to someone before that happens, or if you can minimize the extent of the gangrene, you can save the remainder of the foot or the leg. But if it becomes too extensive and we get there too late, then amputations are what results, and that is a disaster.
Is gangrene much like frostbite?
Frostbite can cause the end stage of frostbite is gangrene. The main thing is that cells and tissue are dead. That's what differentiates it from anything else.
So people have to be careful. You can have some of the most successful athletes in the world who are mountain climbers can get frostbite, gangrene.
Well, frostbite is a different entity. Obviously, it has to do with hypothermia that goes into the tissues. Hypothermia in the tissues or frostbite can often be saved, even if it looks bad. So if someone has that, they need to get to a hospital and get evaluated right away. But gangrene from problems with absence of circulation, of arterial circulation, that can only be fixed by restoring the circulation and restoring the circulation quickly to save the parts that have not been rendered already beyond help.
And on a high note and a good note is that if you go to a great doctor like Dr. Bernstein, or even maybe not such a great doctor, but they see it, it can be helped. You can, in other words, the important thing is be aware that your health is your number one interest in life, more than anything else. Is that a fair statement?
Denial is not necessarily a river in Egypt. That's number one. And
Right.
number two, time is tissue. So the best way to prevent something disastrously from occurring, and remember, if someone has a problem that they end up with gangrene or an amputation, it's not them who just suffers, their family suffers. Person can no longer walk, person can no longer work and get a job. Person can no longer drive and go where they want to do what things they want to do. It's a disaster for the patient and the family. So we say time is tissue. That means if there are symptoms that a person is concerned about, they need to get that checked out right away. The worst that can happen is they get an arterial ultrasound, which does not hurt at all, or a physical examination, which nothing hurts about that either. And that's the potential to save their legs and save their lives.
Ultrasound, just so everybody understands, is non-invasive.
It's completely non-invasive.
Yeah.
It's done with a microphone that sends out sound waves into the tissues. The sound waves bounce back to the transducer, and it puts a waveform and basically a picture on the screen that we can objectively look at and quantify the areas that may be blocked and how blocked they are.
Now, if anybody is either a diabetic, and I don't care if you're born with it or you're a type 2 diabetic, or you have diabetic tendencies, and I'm going to urge everybody to understand this, and your diet is not conducive to good health. Everybody, and by the way, you may even think you're eating well. It's worth it to ask your family physician, hire a nutritionist, do something to begin. I don't care what age you are, whether you're 20, 40, 60, 80, 100, to begin to understand that as you eat and as you experience life, it is so vital to make sure that you don't come even close to amputation. Because as Dr. Bernstein pointed out, amputees die within 2 years. It's a terrible thing. Now, by the way, having a dog or a pet is a really good reason to live healthier and longer.
That's right. This is Scrubs, and Scrubs is our facility dog here at our office. He sees patients with us on Thursdays when we're not doing procedures, and patients love to pet him when I'm examining their legs. So that's one of our perks is having Scrubs here.
Now, just so I understand, is Scrubs a golden retriever?
Yeah, Scrubs is a golden retriever who's specially trained to be our facility dog.
Uh, I tell you, I was so happy that I met and know now Dr. Bernstein. I'm deeply honored that he said he'd be on the show today. And I got to tell you something, that which you are doing is so important. Somebody's life literally is being saved because of what we're doing today. And Dr. Bernstein's organization is called ACV, which stands for Advanced Cardiovascular Center, the Las Vegas Amputation Prevention Center.
That's
And
correct. And anyone, if they would like to get in touch with me, even for a question, I'm available. They can just email me at rbernstein at ace. Oh,
everything, it's all going to be in the show notes, because
you got it.
you know, you have to write it down and everything. Just it's
Fair enough.
all in the show notes. And the amazing thing is, we are a worldwide broadcast.
Mm-hmm.
God willing, you're going to get emails from people around the world. I'm looking
Hope
forward.
so. Hope
Right.
so.
That's what we're here for. Okay, I'm loath to say the words I'm about to say. However, this is the world of time. We're running out of our time today. So I have 3 quick questions for you. Dr. Bernstein, are you ready, sir?
Ready.
Number 1, will you come back again?
It will be an honor. Thank you.
I'm touched. Number 2, Dr. Bernstein, you have 80 seconds to answer this question. I think I know where it's going to go. However, I'd like you to articulate it. What is your most fervent desire?
My most fervent desire is to prevent every single possible person who hears the sound of my voice from getting any type of an amputation in their leg, whether it's a toe, a foot, or a leg itself, because saving legs saves lives.
Great bumper sticker. Okay. Number 3, may I give you a hug in front of 521,917 people around the world?
That would be great. Scrubs will not mind.
Now, let me tell you what HUG stands for. Heartfelt, unlimited giving. On the count of 3. 1, 2, 3.
Hug it is.
And remember, you're listening to Eye on Las Vegas with your humble host, Barry Shaw, the ambassador of joy, Dr. Rick Bernstein, the man who stops amputations. And I'm going to give a blessing from Dr. Bernstein and Barry Shaw. Go forth. Live exuberantly. Spread the seeds of joy, happiness, peace, and love. Go mad. Go make a difference. Dr. Bernstein, don't go away.